Let's go through a few different classes of drugs and look at how they are associated with drug-induced lung disease. The first class, and perhaps the most common class, is antineoplastic therapy or anti-cancer agents. Approximately 10 to 20% of patients treated with an antineoplastic agent will present with some form of lung toxicity. This is thought to be due to several reasons, but primarily because the lungs receive the entire blood supply because they're the source of oxygen, which perfuses all the body's tissues that is necessary. And that leads to extensive exposure to antineoplastic agents. You can see here in the diagram that as the blood goes by the alveolus, oxygen goes in and carbon dioxide goes out. If the drug is traveling through the blood supply along with those blood cells, it's increasingly exposed to the lung, predisposing the lung tissue to the drug-induced lung disease. For antineoplastic therapy, the specific pathogenesis or the specific etiology of drug-induced lung disease is not clearly understood. However, it is typically attributed to direct cytotoxicity. You've had other lectures on antineoplastic therapy where you learned more about the cytotoxic properties of those agents, and this applies to the lung tissue as well, even though the lungs may not be the target of those antineoplastic therapies. Some of the proposed mechanisms include cytokine-induced damage, oxidative injury, repair mechanisms, and lastly, radiation-induced injury. If we look a little bit more in detail into these specific potential causes, we'll learn more about each one individually. Let's talk first about cytokine-induced damage. Cytokine-induced damage comes from an increased release of inflammatory cytokines. This is potentially from cell apoptosis or other mechanisms from introduction of the antineoplastic agent. Some examples of these inflammatory cytokines include interleukin B, interleukin 6, and tumor necrosis factor alpha. A key example of a drug that causes cytokine-induced damage is gemcitabine. The most common manifestation of this drug-induced pulmonary disease is interstitial pneumonitis. The most common manifestation of this drug-induced pulmonary disease is interstitial pneumonitis. Some of the other manifestations include diffuse alveolar damage, capillary leak syndrome with non-cardiogenic pulmonary edema or pulmonary edema that arises from a non-cardiac cause, alveolar hemorrhage, which may present as hemoptysis or coughing up blood, pleural effusions, and acute eosinophilic pneumonia. The next cause of antineoplastic therapy-induced pulmonary disease is oxidative injury. Oxidative injury occurs when there is a release of free radicals or reactive oxygen species, which then go on to attack the cells. So as you see here in the picture, we may have a normal cell, which is then attacked by these free radicals, which you see indicated by the brown speckles, and that causes damage to the cell. And you can see that cell actually looks like it's in very poor condition. And this is a graphic example of what one might see in pulmonary disease that comes from oxidative injury from antineoplastic therapy.